It usually starts off simple, just a little pill to help with blood pressure, maybe one for cholesterol, and then something else to sleep a bit better at night. But over time, a friend down at the community garden said her kitchen cabinet looked more like a pharmacy than a pantry. And the odd thing, she wasn't feeling any better. In fact, she was feeling worse, tired all the time, foggy in the head, stomach off, and just not herself. Her doctor assured her everything was within normal limits. But what on earth? Does that even mean when your joints ache, your mind's a bit scrambled, and you can't remember if you already took your morning pill? Or was that yesterday's? The thing is, most folks don't realize that as we age, our bodies process medication differently. What worked fine at 45 might not work so great at 70. Our liver and kidneys slow down, our muscle mass changes, and suddenly that low-dose prescription starts acting like a double shot of something much stronger. And here's the kicker. Sometimes the very medicine that's supposed to help us ends up causing new symptoms, leading to, you guessed it, another prescription. A neighbor of mine, Enrique, ended up on 7 medications before someone realized the dizziness he kept blaming on getting old was actually from a drug interaction. Took his new geriatric pharmacist all of 10 minutes to figure it out. He's down to 3 pills now and says he feels like someone cleaned out the cobwebs in his brain. The worst part is, this cycle of over-medication creeps in so quietly. No big warning signs, just little annoyances we chalk up to aging. A little more tired, a little more forgetful, a few more stomach issues. But what if those signs weren't just aging at all? What if they were red flags waving furiously, trying to tell us something's off? It's a warning sign most seniors miss, and it's not because we're not paying attention. It's because we've been taught to trust the pills, trust the experts. Don't ask too many questions. But let's be honest, some of those experts haven't seen us in years, let alone adjusted our meds for the way our bodies have changed. And these days, who even sees the same doctor twice in a row? It's like playing musical chairs, but with your health. Now, this isn't about tossing your medicine in the trash or ignoring professional advice, but it is about becoming the captain of your own ship. Because when it comes to our health, blind trust can be a dangerous thing. So if you've been feeling just a little off lately, or if your friend keeps forgetting what day it is and chalks it up to senior moments, it might be time to take a closer look at what's really going on behind the scenes. Over the next few minutes, we're going to dig into what your doctor may not be telling you, how to spot the signs your medication may be doing more harm than good, and simple, doable steps to get back in control. Because your golden years shouldn't feel like a long, confusing fog of pill bottles and side effects. They should feel like, well, life. Clear, active, and yours to enjoy, without a chemistry set rattling in your purse or back pocket. Now, let's talk about one of the sneakiest culprits, medication stacking. It's when one pill leads to ECOI, side effect that gets mistaken for a new illness, so another pill gets added to treat that. And before you know it, it's a domino effect, right out of a bad soap opera. A woman at bingo night, Eileen, shared how her heartburn pill gave her chronic diarrhea, so they gave her something for that, which then gave her dry mouth so bad she couldn't sleep, and voila, sleep meds joined the mix. 5 pills in. And her original issue still wasn't fixed. It's no wonder some folks say they feel like they're chasing their own tail. And the kicker? Some of these combinations never even get properly checked for interactions, especially when we're seeing one doctor for the heart, another for the joints, and a third who pops in once every 6 months and says things like, "You're doing great," after a 5-minute check. The truth is, most doctors are juggling dozens of patients, and even the best ones can miss things, especially if we don't speak up or question the process. And let's face it, many of us were raised not to question authority. You didn't argue with the teacher, you didn't talk back to the principal, and you sure didn't ask the doctor why the little white pill made you feel like you were floating above your own head. But now it's time we take a different approach, because the medical system wasn't built for people like us. It was built for efficiency, not individuality. And our generation? We're not one size fits all. We've got decades of living behind us, and that means our bodies have stories to tell, stories doctors need to listen to. Like how a friend of mine, Joe, Vietnam vet, tough as nails, started getting tremors in his hands. Thought maybe it was Parkinson's. Turned out it was a side effect of a new cholesterol drug. Switched it out. Tremors gone. Just like that. And yet, for 3 months, he was convinced it was something serious. Even started talking to his kids about getting things in order. Imagine that kind of fear. All because no one bothered to check the med list. It's maddening. What we need is not just more medicine, but better medicine. Medicine that actually fits who we are now, not who we were 20 years ago. And yes, sometimes that means less is more. That means asking your pharmacist, not just your doctor, to do a full medication review. That means bringing your pill bottles into your appointment, not just listing them from memory. That means having someone in your corner who doesn't just see your age on a chart, but sees you, your life, your rhythms, your routines. And it means noticing those little signs, like suddenly feeling confused after starting a new prescription, or noticing your balance isn't what it used to be, and not writing it off as old age just yet. Because sometimes it's not age at all, it's chemistry, and that chemistry can be adjusted. You have the right to ask questions, to double-check, to request alternatives. You're not being difficult, you're being wise. This is your body, your mind, your well-being. And if anyone gives you a hard time about being too cautious, just smile and say, I've lived long enough to know better. Because the truth is, most of us didn't get this far in life by being careless. We made it here because we paid attention, learned from mistakes, and looked out for each other. So if your friend down the street is walking a little slower these days, or complaining about feeling just off, maybe forward this along. Sometimes all it takes is a little nudge to start asking the right questions. And that, right there, could be the first step toward feeling better than you have in years. And here's where things get really interesting, because even when we start asking questions, getting answers can feel like trying to read the fine print on a medicine bottle, without your glasses after the cat knocked them under the couch. Have you ever noticed how the side effects list is longer than a CVS receipt? Fatigue, nausea, dizziness, confusion. Some sound suspiciously similar to what we already chalk up to aging. That's the trap. We're told it's just part of getting older, but let's pause for a moment and really think about that. Since when did getting older mean giving up clarity, energy, or peace of mind? A friend of mine named Shirley, bless her, sharp as a tack, started having trouble remembering names. Everyone assumed it was early memory loss. Her daughter even started researching memory care facilities. But Shirley wasn't ready to give up her crossword puzzles and bridge nights just yet. So she went to a new specialist, who immediately flagged that one of her blood pressure meds was interfering with brain function. Swapped it out, and within weeks she was back to finishing the Sunday puzzle in pen. Not perfect, of course, but no longer confusing her son with the neighbor's dog. That's the difference a good medication and review can make. And here's the thing, nobody's going to advocate for your health like you will. Not the insurance companies, not the busy nurse practitioners, and certainly not the system that rushes us through like cattle at a stockyard. If you've gotten this far into the video and found yourself nodding along or thinking of someone who needs to hear this, then here's a little friendly advice. Go ahead and hit that subscribe button. Not because we're trying to be one of those fancy influencer channels with flashy intros and techno music, but because this space is different. Here, it's about real talk for real people in the real stage of life. It's about making sure you don't feel alone in a world that sometimes treats you like you're invisible. Subscribing means staying in the loop when we share more of these kinds of insights, the kind that could spare you weeks of dizziness or months of fatigue and help you walk into your next doctor's visit armed with the right questions. Think of it like joining a community of sharp-eyed, sharp-minded folks who've had enough of being brushed aside and are ready to take the reins. And yes, some of us still use paper calendars, and no, we're not downloading 5 new apps to figure it out, but we are paying attention, and we are learning how to make the system work for us, not against us. It's also where you'll hear more stories from folks like Reggie, who found out his afternoon headaches weren't from screen time, like his grandson suggested, because, let's be honest, Reggie still uses a flip phone, but from a double dose of medication prescribed by 2 different doctors who weren't comparing notes. And those headaches? Gone, once someone finally connected the dots. So if you're tired of being tired, or if something just doesn't feel quite right lately, you're not alone, and you're not crazy. There's always more to the story, and it's worth uncovering. Stick around, because in the next part, we'll break down exactly what to look for when reviewing your medications, how to talk to your pharmacist without sounding paranoid, and what one retired nurse calls the coffee cup method for organizing your prescriptions in a way your doctor will actually understand. Trust me, you won't want to miss it. It's clever, it's simple, and according to the fellows at the community center, it saved more than a few wallets from unnecessary copays and more than a few brains from unnecessary brain fog. Now let's get into the nitty-gritty, because it's one thing to suspect your medication might be causing issues, but it's another to figure out what to do about it without feeling like you're trying to defuse a bomb with a butter knife. That's where the coffee cup method comes in. And no, it doesn't involve drinking your pills with caffeine. Though, let's be honest, some mornings it feels like we need both just to get moving. This came from a retired nurse named Harriet, who said when things started getting confusing with her own medications, she sat down one morning with a coffee mug, a notepad, and a pile of pill bottles. She made 3 lists, one for medications she took in the morning, one for the evening, and one for occasional use. Then she wrote down what each one was supposed to be treating. Not what the label said, but what she remembered the doctor told her. Then she called her pharmacist, not the doctor, and asked for a full medication review. Turned out, she was taking 2 drugs that treated the same thing prescribed by 2 different doctors who never talked to each other, and one of them? It was making her blood pressure drop so low that she kept thinking she was standing up too fast when she felt woozy. You'd be amazed how often this happens. Nobody's trying to mess things up. It's just that in a busy system, nobody's looking at the whole picture unless you put it right in front of them. So make the list. Bring it to your next appointment. Ask the pharmacist, do any of these interact with each other? Are there any I don't really need anymore? Because often we stay on meds that were meant to be temporary, like acid reducers, sleep aids, or even antibiotics that somehow sneak into the long-term rotation like an uninvited guest who won't leave the party. And while you're at it, ask about alternatives. Sometimes a lower dose works just as well. Sometimes diet changes, light movement, or supplements, yes, the right kind, can reduce your need for something stronger. A fellow named Curtis, who volunteers at the VFW, said he dropped one of his cholesterol meds after his doc saw how much his numbers improved just by switching from canned soup to fresh. Simple stuff, but powerful. Of course, not all doctors are thrilled when you start asking too many questions. Some might get defensive, but here's the thing. They work for you. You're the boss. And if they don't treat you that way, it might be time to shop around. Because there are good ones out there, ones who listen, who take their time, and who appreciate when a patient wants to be proactive. You just might have to be persistent, which, let's be honest, has never been a problem for our generation. We've stood in longer lines for concert tickets and Black Friday sales. We've waited for dial-up internet, handwritten letters, and Saturday morning cartoons. A little persistence? That's nothing new. And if anyone suggests you're being difficult, well, let them. You've earned the right to be thorough, and maybe pass that wisdom along to a friend who's been too tired to meet up lately or keeps mixing up their pillbox days. Ask them if they've done their own coffee cup check. Sometimes a little conversation can spark a big change, because this isn't just about avoiding side effects or cutting down on pills. It's about getting back to you, the version of you who enjoys reading the paper, going for walks, or gardening without feeling like you've been hit by a truck. And yes, there will still be aches and pains, and we're not pretending any of us are 25 again. But if some of those struggles are being caused by the very pills meant to help, well, that's a fixable problem. And that, my friend, is where real hope lies. Because when we start paying attention to these signs, when we connect the dots, speak up, and ask for help from people who actually understand the big picture, we're not just improving our health. We're reclaiming control, one cup of coffee, one list, one conversation at a time. So here we are, bringing it all together, and if you've stuck with this conversation until now, chances are something in all of this rang true, whether it's a medication that doesn't feel quite right, a friend whose aging symptoms came on a little too fast, or just that nagging feeling that maybe, just maybe, things could be better than they are. And they can. Not perfect, let's not kid ourselves. We're not trying to win marathons or start a vegan TikTok channel, but better. Clearer minds, steadier steps, calmer stomachs, fewer mystery aches. That kind of better. One woman named Teresa Church, choir singer, world-class cookie baker, and part-time neighborhood sleuth, used to say she felt like she was disappearing inside her own body. Turns out she was taking a medication that had slowly dulled her senses over time. She pushed back, asked for alternatives, and within 2 months, she said she felt like she woke up from a fog. She even started cracking more jokes at choir practice, some of them pretty good. That's the transformation we're talking about here. Small, steady changes that bring back the spark. And all it took was one conversation, one question, one refusal to accept that this is just how it is now. You deserve that kind of clarity. You've earned it after raising families, building careers, paying mortgages with interest rates that would make today's homeowners faint, and adjusting to more tech changes than any generation in history. You didn't survive rotary phones and record players just to get pushed around by a handful of poorly matched prescriptions. So this is your moment to take back the reins. Review your medications, talk to your pharmacist, ask your doctor real questions. Bring a friend or family member to appointments if you need backup. And if you found even one useful tip in everything we've talked about today, go ahead and hit that like button so this video reaches others who need it too. More importantly, drop a comment. What did you learn? What changes have you noticed? After switching or stopping a medication, let's share those wins because one story might be the lifeline someone else needs. And if you haven't already, subscribe to stay connected. We've got more coming, videos on how to talk to your doctor without feeling rushed, natural ways to boost your energy without caffeine jitters, and yes, more real-life stories from folks just like you who found smarter ways to feel good again. Don't wait until the next dizzy spell or sleepless night. This is your sign. Make that call, check that bottle, start that conversation, and always remember, you're not alone in this. You're part of a growing community of people who still believe in common sense, second opinions, and the idea that getting older doesn't mean getting ignored. It means getting wiser and using that wisdom to make better choices for yourself and for those you love. So, keep showing up, keep asking, keep believing that feeling better isn't just possible, it's likely when you've got the right tools. Until next time, take care of yourself and know this. Your best days don't have to be behind you. They can be right now, right here, starting with one small step, because sometimes the difference between sick and well is just one pill away.